AJ here. Today we are doing a comprehensive examination physical for an older adult. So the first thing I want to do is start off by washing my hands. Alright, to start off with the comprehensive adult physical, I'm going to have AJ walk for me. I know this area is kind of limited, but I'll have you walk from the one side, turn around, and walk back for me. And I'll tell you when to turn around. Go ahead and turn around and back this way. Excellent, and now back to the front. So while doing that, I'm deconstructing his walk. I'm noticing how the degrees that he's movement and making sure that his arm is symmetrical. Also, I'm seeing how his stride is, and also the demand of when I asked him to turn. I want to make sure that it's not a choppy movement, and I want to make sure that he's turning nice pivot and turn correctly. So that all seemed pretty normal. So the next thing I want you to do is take a step forward, and I'm going to have you feet together and your eyes closed, and I'm going to put my arms out for safety. I'm just going to have you stand there nice and still, and I'm going to go ahead and test for the rumbar for him. Excellent. So there was no sway. Excellent. So the next thing I'm going to do is I'm going to go ahead and get this chair down right in the center. And AJ, if you'd like to have a seat, I'm going to go ahead and start off by checking his ears. Nice clear. And on to the other side. Nice and clear. And I can visualize the tympanic membrane. So the next thing I want to do is I want to go ahead and look into his mouth. AJ, if you can open your mouth for me. And I'm going to inspect all the teeth to make sure there's no problems with the teeth. Also, his tongue is red and shiny. And also, I want to make sure that the palate of the roof of his mouth is symmetrical and that there's no abnormalities. So also, while I'm here, I'm going to check his eyes. I'm going to go ahead and have you look straight ahead, and I'm going to do a pupil check. So I'm going to bring the light out, and under direct light and consensual, direct light and consensual. Excellent. So the next thing I want you to do is I want you to look straight ahead, and I'm going to test the external ocular movements. So I'm going to have you follow my finger for me. Excellent. While doing that, what I'm really doing is not only am I having him move his eyes, and I'm actually looking at his eyes and the movement, I'm also checking for any jerkiness that's going on into his eyes to show that there might be some kind of problem with the brain. So the next thing I want to do is I'm going to test his fields, his visual fields. And what I'm going to have you do is I'm going to have you look straight ahead, and I want you to tell me which hand is moving.
Left. Right. Both.
Excellent. So there was no abnormalities when it came to his visual field. So the next thing I want to do is I'm going to move his head sideways then the tibialis pulses. And this is posterior tibialis. Brachial. The radial. And then I could also do his carotid as well, which we checked earlier. So, DJ, if you could just move your feet upwards a little bit, sure I can slide back here if you don't mind. The knees if you don't mind. Can you slide back? Excellent. So the next thing I'm going to do